we're going to briefly look at how the key findings from the community consultations are actually reflected and fully incorporated in the targeting and prioritization approaches. So we can move to the next slide. During community consultations, refugees were consulted, among other aspects, on vulnerability and specifically asked to share their general perception on vulnerability in the communities, provide feedback on a proposed set of eligibility criteria, and also share potential additions or changes to the criteria. And the main findings from the consultations highlighted that all the criteria that were proposed were validated as able to capture the most vulnerable within the communities, and that some additional characteristics identified and brought up to the discussions by the refugees were integrated either in the final set of eligibility criteria or within the prioritization approach that has been developed. And lastly, the need for livelihood support for refugees has been collectively raised in both the Rwanda and Cameroon case. Next slide. The community consultations are an essential step the targeting and prioritization process. However, the findings from the community consultations are not able to fully replace the findings from quantitative analysis, but rather they complement the already available quantitative evidence and are also a useful tool to leverage to establish the importance of each eligibility criteria, which could be quite useful in a resource constraints context, entailing prioritization decisions. Second, the community consultations do not aim to inform the refugee communities on how the targeted assistance packages will be built and on specific details on the implementation, such as when the implementation will take place, the exact amount of assistance, as these consultations happen before the implementation. And the consultations rather aim to consult the refugees on reactions to the potential changes to their current situations and also provide useful insights to plan implementation later on. Third, through the community consultations, we're not aiming to identify the exact beneficiaries of targeted assistance, but rather to identify the social, demographic, and protection profiles of these beneficiaries. And lastly, the community consultations are not a tool to decide whether and which complementary interventions will be provided, for example, in addition to cash and food assistance, but rather a way to suggest additional areas of support by the communities on specific cases, such as, for example, livelihood support, as it has been mentioned frequently both in the Rwanda and Cameroon country context. Next slide, please, Emmanuel. Yes, so in Rwanda and Cameroon, a tailored set of eligibility criteria was discussed and validated during community consultation. And this has led to the validation and finalization of 8 criteria for the Rwanda case and 10 eligibility criteria for the Cameroon case, comprising both social, demographic, and protection sensitive aspects. And for example, for what concerns Rwanda, we can see that the criteria focus, for example, on the dependency ratio and on the household size, but also comprise aspects of presence of disabled and chronically ill members, as well as member at risk. And on the Cameroon case, for example, they focus again on the dependency ratio and more on the presence of children, also looking at the household headed by children and those encompassing unaccompanied or separate children, as well as presence of members that are disabled or chronically ill. So once the feedback from the community consultation is received and analyzed, in the next slide, show how this is integrated into the targeting and prioritization process. Next slide, please, Mon. So first of all, the community feedback on the proposed eligibility criteria is reviewed and validated together with the country teams. This leads to the finalization of a set of eligibility criteria and also the development and finalization of a targeting and prioritization approach, as well as assistance packages that will be tailored and adapted to each country context based on prioritization needs. Lastly, there will be a review and finalization of targeting risk assessment and the development and finalization of a mitigation plan. Next slide, please. Next one, please. Sorry, I don't see that. Yeah. So lastly, a methodological review of the challenges and lessons learned from the community consultation exercises in Rwanda and Cameroon has highlighted several aspects, such as, for example, the trade-off between representativeness and the volume of consultations held, and the importance of selecting consultation sites carefully in order to capture representative and in-depth information, as opposed to prioritizing the highest number of locations. And this is, of course, this is a decision that should be driven by context-specific considerations. Second, training and tool pre-testing are essential steps of community consultations, as they have the potential to strengthen the quality of the discussion and also of the collected information, and also to help the management of the discussions during the community consultations, especially in challenging contexts. However, as it's been mentioned, for both the Rwanda and Cameroon cases, staff capacity and time should be really allocated to this portion of work. And it could be challenging in some cases, for example, where we observe limited staff capacity, and this might have implication on the length and optimal structure of both training and pre-testing. Regarding pre-testing, it may not always be smooth to implement pre-testing, and in some cases, this is what happened in Rwanda, it could be even weight, especially in those cases where threats of rumor spreading, which have the potential to influence the future discussions that will be held through community consultations, are deemed to be an important risk to the quality of collected information. Third, the recruitment of participants should be planned quite carefully. This has been mentioned already, but basically it should also take into account social norms and cultural standards, and also ensure that all the participants' voices are heard equally. In particularly challenging contexts where this cannot be ensured, and there's a threat of more influencing groups influencing the discussions and limiting the other participants' freedom of expression. It could be a recommendation to hold discussions separately in order to ensure that all voices are heard. With the goal of achieving high data quality and also limit respondents' fatigue, the length of the consultation sessions, as well as the focus of questions, what we really aim to capture with these questions, should be planned very carefully, and especially tailoring the focus of questions could be very important, especially in a prioritization context, entailing constraints to available resources, when, for example, refugees or participants can be specifically consulted on specific criteria or combinations of criteria to really capture the most vulnerable within the communities. And lastly, the note-taking process should be harmonized as much as possible to limit data harmonization challenges and also processes which at times might be quite time-consuming, and also increase the precision, the overall precision of the collected information. So with this slide, I would like to thank you for your attention, and over to you.